Good morning. So, few things which we want to start here with, right? First of all, as I was discussing and asking you unofficially, and now I'll request again that we had a very useful day yesterday. True? And majority of you said you learned one or more than one thing yesterday. And as I was talking to most of them, they were saying that this is something unique and special. So, if you think yesterday was good, today is going to be better and great. Right, so please एक बार सब सारे teachers के लिए जोर से ताली बजा दें because they have put in a lot of hard work to do this. And the best part is that normally in any course you go, the attendance of the faculty on day 1 is more and day 2 it diminishes. So here you are seeing that it's maintained and even increased here. So we have Professor Tuli sir here today. So right in the morning. So एक बार sir के लिए तो अलग से ताली बजा दें. If you see, you know, the tagline of Conceptual, the learning never ends, right? This is such a beautiful tagline. You can put this anywhere in life, it will never fail, right? कहीं पर भी personal, professionally आप ये line को fit कर दीजिए, कभी fail होगा ही नहीं. So this is the line that sir gave to us when we thought of Conceptual Orthopedics. Professor Tuli sir, this is the line he spoke when we thought of Conceptual Orthopedics. So एक बार इसके लिए ताली बजा दीजिए. ये घर में कोई आपको डांट भी रहा होगा, वाइफ से भी लड़ाई होगी, आप बोलोगे मैं आप मानता हूँ द लर्निंग नेवर एंड्स, आगे से केयरफुल रहूँगा, लड़ाइयाँ बच जाती हैं. 5 साल हो गए मुझको यूज़ करते हुए, इट्स वेरी यूजफुल. ऑलराइट, सो दिस इज समथिंग विच विल वर्क एवरीवेयर. एंड यू नो अ स्मॉल पीस, यू नो दैट आई रिमेंबर when we look at conceptual, I spoke this when we were doing the previous course also. We are very very emotional about this organization because ये एक generations का रिश्ता है. So there are different relationships in this organization. So I'll just tell you how it is. Professor Tuli sir is teacher of all of us. He happens to be the teacher of Professor Ajit Kumar sir, who is senior of Professor Dhal sir, who is senior of Professor Bhasin sir, and he is teacher of all of us. All of them are teachers of us, and then the next generation is also teaching here. So there are 4 generations actually in this organization. So when you look at the roots, you know, that's very important, you know. And so I'll just tell you, it's a very simple story which I always put on Facebook. Every year I share it on my dad's birthday. So the story goes like this, that a boy is sitting in his office, and his father is standing beside him, and he asks him that who is the most powerful person in the room? So the boy says, me. So the father says कि arrogance आ गया इसके अंदर. So the father quietly walks out and the boy follows him, and they sit in the car and they drive back home. He said, when I asked you in the room that who is the most powerful, तुम नहीं हो, तुम ऐसे कभी नहीं बोलते. How could you say that you are most powerful in front of me? He said, नहीं, उस टाइम पे पापा आपका जो हाथ है मेरे कंधे पे था. So आपका हाथ मेरे कंधे पे था, इसीलिए I was the most powerful in the room. अब तो आप ही हो. So that's what you have to understand. So for them, you know, हमें रास्तों की ज़रूरत नहीं है, हमें आपके कदमों के निशान मिल गए हैं. For the first row here, that's what we have to understand. It's very simple, you know. Whenever CO में कोई भी प्रॉब्लम होती है, हम अपने सीनियर्स से पूछते हैं, हमें आंसर मिलता है. हम लोग खुद सोचते रहते हैं हफ्तों में. We will just call them and in a flash they will give an answer. मेरा तो मेजॉरिटी इंटरेक्शन डॉक्टर भसीन ही सॉल्व कर देते हैं. सो ही इज़ वेरी सिंपली देयर. सो ही जस्ट टेल यू ये आंसर है, ये कर दे बस. ओके. डॉक्टर धल अगर बोलते हैं वेल, ये वर्ड वेल मतलब जो मैंने सेशन दिया वो आउट है. मैं बोलता हूँ हो गया सर, थैंक यू, वेल, यू नो. एंड देन फाइनली जब लेवल ऊपर होता है, फिर देन आई रीच टू कुमार सर. सो बेसिकली अगर हम बोलते हैं, आई ऑलवेज से कंसेप्चुअल ऑर्थोपेडिक्स इज a description of relationship of Professor Sudhir Kumar sir. सर एक बार खड़े हो जाइए. They should know that अगर देखें तो sir walked to everybody to make this organization. Dr. Tuli's home, Dr. Dhal, Dr. Bhasin, and he is the one, you know. कहते हैं ना ये सारे मोतियों को साथ में सर ने ही ला के सबको खड़ा किया. So that's what he has done. Even down side Professor Shantaram Shetty sir, and then you know कहते हैं ना अकेले चल के कारवा बनता गया. But we have got very strong base. एंड दैट्स वाई हमेशा से ये होता है ना, हम हिंदुस्तानियों को क्या है, कोई भी पूछो विदेशी किताब का नाम दे देंगे, विदेशी बंदे का नाम दे देंगे, बट मैं गारंटी दे रहा हूँ आपको, इस कोर्स पे तो गारंटी दे रहा हूँ कि कोई करके दिखा दे, दुनिया के किसी कोने में करके दिखा दे, हो ही नहीं सकता, इस शिद्दत से, इस मेहनत से, इस तरीके से नहीं हो सकता। सो एक कोर्स तो हम कह सकते हैं ना, क्लास अपार्ट है। ताली बजाओ यार, इस बात पे खुश होना चाहिए, यू आर अ पार्ट ऑफ दिस जर्नी, सो आई एम सेइंग दैट सर ने जैसे लास्ट कल का जो मैंने वीडियो दिखाया तो दल सर ने बोला कि विदेश से भी लोग आएंगे, अब लोग सीखने आएंगे कि पढ़ाया कैसे जाए। दिस इज व्हाट द ड्रीम ऑफ CEO was. Aim was not to live forever. Aim is to create something that can. This is what it is. This is what is there. So CEO is something. बजाओ यार, ताली क्यों नहीं बजा रहे आप लोग, क्यों दुखी क्यों यार, है ना? Let there be joy in the room. उसमें नुकसान क्या है ना? So when we thought of conceptual orthopedics, the word, the different names, and Dr. Kumar sir approved of this name, conceptual orthopedics. So I wrote a mail to Harsha Bhogle, keeping them in the mind. So I have been a follower of cricket, and so it was everything, and we know Tendulkar. So Harsha Bhogle described a line for Tendulkar's straight drive with a touch of class and a stamp of authority. So I wrote a mail to him that, can I use this line for conceptual orthopedics, and I have a legal permission for that. He wrote in a flash, of course. So that is what they do, with a touch of class and a stamp of authority. This is what conceptual orthopedics in every program means. All right? All of them, this is what I say. माना है कि चुपचाप खड़े रहते हैं, बस जो लोग बड़े होते हैं वो बड़े होते हैं। हमारी महफिल सजती है इन लोगों से, इनके कदमों पे कई ताज पड़े रहते हैं। So we will request Professor S.N. Tuli sir, for coming and addressing you right in the morning. He will initially behave that he doesn't want to speak, then he will speak, and then after he has spoken, he will say, can I speak one more thing? So he loves talking to the student. This is what he always loves. And you will see that during the course of the day, you will see he will be the most active person in the room. He will be having maximum questions, he will be interacting with all of you, and you will only learn one thing from him, that the learning never ends. This is what you should know. With the strength of a tiger, with the agility of a youth, standing tall at 92.
I feel humble that I am amongst the elite of orthopedics in my country, the orthopedicians who are the future of this great country. I also feel honored that I have been given an opportunity to spend some time with you and to interact with you, meet you all. I don't think I have many things to speak. However, I would certainly make a statement. Let's not forget, everything is obvious in orthopedics. We must learn this thing. And from the very first day, we should learn that we should be truthful all the time to the patients, to the families, and amongst our own self. It is repeating again, everything is obvious in orthopedics. And look at the beautiful investigations available to us today. MRI. Look at MRI. Don't depend what the MRI producers have written. Read yourself, interpret it according to the information in front of you, the patient in front of you. You will interpret it far better. If I made a patient one leg shorter than the other by 2 inches, it is visible to the whole world. If a walker has been converted into a non-walker after surgery, it is visible to everybody. So let us learn from the very first day, let me speak the truth and never untruth to the patient, to the relations, and even amongst our own self. The whole spectrum of orthopedics is going to change. In this country, when the Britishers left us, an average age of an Indian was 50 years. By the year 2000, average age of an Indian was 60. Today, the average age of an Indian is 70 plus, but well provided homes are all going to cross 80s. You are going to have, I'm not talking of trauma, you are going to have the largest number of people coming to you between the age of 60 and 80. And most of these patients will have many comorbidities, which means we as physicians, we as orthopedicians should be aware of those comorbidities. We should be aware that they have to be taken care of before we put these patients, especially for surgical technique. So we must maintain interpersonal relationship amongst our own self and interpersonal relationship with other disciplines of medicine, so that we can give the best to a person coming to you between the age of 60 and 80. And all of you will cross 80s. All of you will stay active. I pray you maintain good health, good nutrition, and a healthy lifestyle. Stay healthy to serve the people. I wish you all the best.
So good morning, all of you. And the program, all of you must be having a copy of that. And as I briefed you yesterday, all of you have got your toy yesterday. I think it is very important to realize that there is a child in all of us. This child will never die. And that child is always enamored, attracted by a toy. It may be a mobile phone, it may be a Ferrari, it may be a Mercedes, it may be a BMW, it may be another gadget, and it may be a magnifying loupe. The wisdom lies in the fact that you use this toy for the betterment of your patient, and that is what it is all about. I was extremely satisfied yesterday towards the end of the day when I saw majority of you, maybe all of you, were wearing the loupes and were able to put the sutures there, which is a great achievement on your part because it takes time. As you have developed that ability to be able to work with magnification, today we are going to move to something which is hardcore working with magnification. We would be starting with the exercise of somewhere in the beginning only. We will be giving you gloves, and before that there is a talk on the application of microsurgical knot and glove repair. There is also a talk on the microsurgical instruments, how they have to be handled, how to take care of them when you are keeping them away, how to make best use of them. Thereafter, we move on to nerve repair. So we have two talks there, and one is an early nerve repair. What is it? The second one is about delayed nerve repair. And then we have the exercise on chicken leg, as we have talked about yesterday, where you have a tremendous opportunity to use the loupes and to develop the psychomotor skill for neurovascular bundle dissection, which is of a reasonable dimension. Doable with a loop, but it will probably need some effort. And the trick is that the bottom line is that you don't have to damage, do not snip the vein or the artery and still be able to dissect out the sciatic nerve. And once you have dissected it out, you will transect it and repair it. These are two exercises which are there. And then later in the day, we have a talk on the nuances of vessel repair. followed as the last item arterial repair in a pig model. Okay, so the artery will be dissected out, given to you. You don't have to dissect it out. So it is dissected out specimen, because the idea is to just train you on how to apply sutures into a transected blood vessel. The exercise is the simplest possible, an end-to-end repair, meaning thereby that it's a sharp transection, there is no gap, and that is what we are training you, because we want you to move from the first step to the top step, not invert the whole thing. Okay. These days things are changing. I do not know for good or for bad. When I was trained in reconstructive surgery, we had a reconstructive ladder. Split skin grafting, full thickness skin grafting, local pedicle flap, and distant free flap was the top of the ladder. All this is changed. There is a term called reconstructive elevator which has come in. That means there is no need to, if you have ultimately to do a flap, and if you are anticipating that it's going to be a distant flap, a microvascular anastomosis is required, do it on one day, on the first day. But we are training postgraduate students, and it is very important. The content of the course has to be according to the target audience. We don't want, once you are into it, once you are into the game, it is for you to develop the skill, to see at what level you want to reach, whether you want to pursue it as a subspecialty career or not. The idea here is to give you an overview and to attract you, to give you this as an option, so that you do not have the option only of a joint replacement or an arthroscopy or something which can be done only when you have nothing else to do. At leisure, you give the time, the patient comes at that time, you operate, go home, had fun with your family. Okay? But remember, hand surgery is a hard option. And hard options, nobody is taking these days. I was talking to an army commander, and he said, it's very unfortunate, Anil, he happened to be my wife's uncle. He was a corps commander, he is no more. But we are talking about 15 years ago. He told me that the trend is nobody wants to go into infantry today, no officer. When they want to get into the various areas, nobody wants to get into infantry, artillery, because these are the areas where you are liable to be killed or you are liable to be deprived of some part of the body. So that is percolating in all walks of life. But then if you are in the army, you have to be in the eye of the storm. There is no fun in sitting home, isn't it? So if you are an orthopedic surgeon, for me, the fun is to be there in the middle of the night doing something which the result is obvious the moment you move out of the operation theatre. So if you have repaired a blood vessel, if you have repaired an artery, and if the pulse is there, and the limb is perfused, that is the satisfaction that you are looking for, not the 1 lakh rupees which comes into your pocket after doing a joint replacement surgery. Thank you very much.